It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox back with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the outstanding doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
Indeed, they do. We're going to start off with one of the top plastic surgeons in all of the Dallas and Fort Worth area. It's Dr. John Barnett.
Well, I've kind of always wanted to have larger breasts, but I was married and my husband didn't want me to do it and had a bunch of kids. And so I had a life change. In the 90s, one of my good friends had used Dr. Barnett, and she goes, Kim, you're starting your life over, go see Dr. Barnett.
A breast augmentation is where there are several incisions. The only one that makes any sense is right here where the crease is. You make an incision, you open up a space for the implant to sit in. Very important to put it on top of the muscle. You make a space. You have already decided what size implant that they need. How do you decide what they want, what they need, how big have they been, how big are they now, how tight is their skin? Or you make the operation fit the patient rather than vice versa.
Afterwards, I was here for hours recovering, and I had a friend take me home, and I slept through the night. Waking up, I had very little pain. After about 4 or 5 days, I was pretty comfortable in going and doing. I took a couple days off of work, and then I was back at work.
When Kimberly came in, she needed some changes in her life. She needed her breast done, or wanted them done, and she wanted a new figure. So that's what we did.
It's great. I love it. He did a great job, and I'm very happy with it.
Her breasts are fabulous, if I do say so myself, which I will. They fit her body. She told me a minute ago she looked like she does now when she was 28 years old. And that's what we did for Kimberly. We just gave her a boost in self-esteem. She's happy. It's win-win all the way around.
Dr. Barnett was very personable, very funny and nice, and he takes time to know you, and he lets you know him. And so then you kind of have a relationship before the surgery. So you feel very comfortable, and you trust him, and it was a great experience.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just felt really wasn't comfortable with. And luckily at that time, Dr. Williams told me about the Atopic procedure.
The Atopic procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was here are the facts, here's what's been done on other patients, and here's the proven success rate.
You know, oftentimes patients come to me, you know, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Chiaroscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. You know, there was this weird feeling of intense pressure gone from my back.
After Jesse had the Chiaroscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
For more information on any of the doctors you've seen on today's show, or to even request an appointment, check out our website, bestdocsnetwork.com. Now let's check in with our next best doctor. It's bariatric surgeon, Dr. Scott Stowers from My Bariatric Solutions.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site, or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working, and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Hi, I'm Dr. Harvey Carter with the Best Docs Network. Here's a quick vision factoid. LASIK vision correction can treat nearsightedness, farsightedness, and yes, astigmatism as well. For more information, you can see my videos on bestdocsnetwork.com.
Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases rarely that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It is also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problem is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.
As always, for more information on any of the doctors you've seen on today's show, or to even request an appointment, be sure to head to our website, bestdocsnetwork.com.
That is the place to go. Right now, Candace, the place to go is to introduce the folks to one of the top prosthodontists in the entire Dallas-Fort Worth area. It is Dr. David McFadden.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them. But what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem, and that's one of the most satisfying parts.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off. And I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Don't skip breakfast. Fiber in the morning means less hunger late in the afternoon, when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
When we get sick, it's nice to know when you're contagious so you don't make other people sick. Well, there is a problem with this in that some infections, specifically viral infections, will make you contagious before you even know you're sick. For example, in influenza, you're contagious for about 36 hours before you get your first symptom. That's a bad thing, and that's why it spreads so well. With pink eye, you're contagious a day or so before you get your red, pussy-looking eyes, and you're contagious for about a day after they start getting better. So it's important to know when you're contagious, and the main way to figure that out is fever. If you have fever, you're definitely contagious in most cases. If you have a virus infection, those are very contagious. Bacterial infections are not so contagious. So if you're coughing up clear mucus or blowing out clear mucus or coughing a dry cough, that tends to be a virus and you're contagious more so than if you're coughing up thick, ugly, green, yellow stuff, which generally is a bacteria. And remember, bacteria are not quite as contagious. So, fever means you're contagious. When you get sick, it means you've probably been contagious for 24 hours already, and you're usually contagious for about 12 hours after your fever goes away. At that point, it's safe to go back to school or work.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Hi, I'm Dr. David Azouz with Best Docs Network. Did you know that there are 3 different breast augmentation implants that we now use? These include saline, silicone, or cohesive gel. If you want more information, please log on to bestdocsnetwork.com.
We have a very active skincare department as part of our aesthetic practice. When patients come here, we are very proud that we can offer them either surgical rejuvenation or skincare.
I think skincare is your icing on the cake. It's going to help address whatever issues you have for tone and texture and evening out skin color.
Some people are just looking for a more youthful look. They don't really need surgery. So these different facial fillers actually enhance their face and make them look a lot younger.
That in conjunction working with Dr. Wilcox and his specialty of surgery, kind of lifting, and Vicki helping plump out and fill lines and smooth lines, the whole thing just works really well together.
Every patient is specific and every need is specific for that patient. So many of them will tell you, they'll tell you, what they're looking for, and then you just kind of go from there.
Consultation entails me examining the skin, and then I can tell you what I think would be the best protocol for what you have going on, whether it's wrinkles or acne scarring or active acne or sun damage. It's usually a program of products, lasers, and chemical pills that will progress along this way to get your skin nice and pretty and glowing.
Many of my patients range from the age of 25 to 70, and I am seeing a lot more men these days. They too want to look better and enhance their appearance. They're competing a lot of times with a lot of guys that are younger than them, so they too want to look really refreshed too. These treatments stimulate collagen and slow down the aging process. They don't correct, they actually improve your overall appearance.
If we can offer either skincare or surgery, then the patients are comfortable knowing we're going to offer them the best treatment for their particular problem.
Hi, and welcome back to the Best Docs Network. In the studio, we're joined today by Dr. Harvey Carter, founder of Carter Eye Center and one of the top LASIK surgeons in not only the Dallas-Fort Worth area, but in the country. It's a privilege to have you here, Dr. Carter. Thanks for joining us.
Thank you for having me.
Now, you were the first FDA investigator to perform LASIK surgery in North Texas. So you're obviously an expert on the subject matter. So I'd like you to talk to us just a little bit about LASIK surgery. If you would start off just by taking us through the process.
The process today is really just dramatic in terms of its ability to rapidly change someone's life in a matter of minutes. Today's technology is blade-free, all laser vision correction. On a surgery day, the patient comes in and they sit in a very comfortable room where their eye drops are applied. They get a light sedation with Valium or something like that if they want, chemical courage as it's called. They then go in the laser vision correction room, and in that room we have a laser that makes your flap. So you have a flap made in your cornea. We have another laser that takes your personalized prescription from your eye and lasers that prescription directly onto your eye.
Wow.
If your prescription was whatever it was in your glasses or contact lenses, it can be literally sculpted onto your cornea so you can throw away, hopefully, your glasses or contact lenses. You put the flap back and they go out, and the entire procedure from walking into the room to walking out of the room is usually less than 5 minutes.
Oh, wow, that's amazing.
Isn't it great?
Absolutely. And if a patient has LASIK surgery, will they be glasses free for the rest of their life, or is it possible that their eyes will regress and they'll have to have surgery again?
There are a variety of ways of doing LASIK surgery. LASIK in general will treat nearsightedness, farsightedness, astigmatism. So it will basically reduce or eliminate the need for glasses for anyone under the age of 40.
To watch more of this video, log on to bestdocsnetwork.com.
Be sure to wash your sheets and other bedding in hot water that is at least 145 degrees to properly sanitize and remove dust mites that can irritate sensitive skin and exacerbate eczema.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Watt, you're presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
See, he had to do a little patch in there. See, the ears aren't the same. I lost part of my ear here. It's healing up a lot better than I thought.
So he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
All right, that'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Candace, for more information about any of these outstanding doctors and watch more life-changing stories, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we'd sure like to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.